Hi, I'm Dr. Jonathan Simons, President and CEO of the Prostate Cancer Foundation. Today we announced a revolutionary new research project to develop a genetic test to identify men at the highest lifetime risk for prostate cancer. I want to take a moment to explain to you what it's about. You know how you get a cholesterol test when you go to the doctor? Well, that test is basically assessing whether or not you're at increased lifetime risk for getting early heart disease. Our new test will assess your lifetime risk of getting prostate cancer. Doctors will be able to use genetics to give you a risk score. This all started with PCF-funded researcher Chris Heyman at the University of Southern California. Dr. Heyman and 191 other researchers discovered that African American men have a significantly higher risk of prostate cancer based on variations in over 200 genes that are associated with this disease. In other words, sadly, men of African descent got dealt a bad genetic hand of cards when it comes to prostate cancer. And this helps explain their 76% higher rate of diagnosis of prostate cancer compared to men of European descent. A lab will someday be able to look at the genetic hand you got dealt, called a polygenic analysis, and tell you how likely it is that you will get prostate cancer. The Prostate Cancer Foundation is funding and fast-forwarding this work thanks to the enormous generosity and vision of Robert Frederick Smith. So, who is this test important to and who will it help? Right now, the first PCF study will concentrate on the African American disparity that exists in prostate cancer diagnosis. Eventually, we hope to expand the test to categorize prostate cancer risk for all adult men. You see, prostate cancer is 99% treatable if detected early, but at the same time it has a reputation for overtreatment. This new test will provide doctors with critical information to determine which patients need to be tested early and often and carefully, and which patients do not. So, what now? After an initial research program that will take us into 2022, U.S. men will be allowed to participate in a national clinical trial for FDA approval. Even though it's not ready yet, you can register at pcf.org and we'll let you know when enrollment opens.